What are cross-state telehealth billing rules? Have you ever wondered how telehealth billing works when your healthcare provider is in a different state? Let's break down the rules and regulations that govern cross-state telehealth billing. First off, healthcare providers must be licensed in the state where the patient is located during the telehealth visit. This means if you are in one state and your provider is in another, they need to have the proper license to treat you there. This rule is essential for all types of telehealth services, including doctor visits, mental health therapy, and remote patient monitoring. Next, it is important to note that each state has its own telehealth regulations and billing policies. These can affect how much providers get paid, what services are covered, and what documentation is required. Therefore, providers must be familiar with the rules of the state where the patient is located. When it comes to Medicare, the program has made strides in expanding telehealth coverage. Patients can now receive services at home, regardless of their location. However, providers must still comply with state licensing laws when billing Medicare. Medicaid coverage for telehealth varies widely by state, and each state has different billing rules and reimbursement rates. For private insurance, many states have laws that requiring insurers to reimburse telehealth services in a similar way to in-person visits. However, the specifics can differ, so providers should check the insurance policies in the patient's state to ensure proper billing. Accurate billing codes are also crucial. The American Medical Association has introduced specific codes for telehealth visits, whether they are audio-video or audio only. Providers need to use these codes correctly to receive payment. Certain healthcare providers, like federally qualified health centers and rural health clinics, have unique billing flexibilities, especially for mental health services. However, some of these flexibilities may expire by the end of 2025, so it's important to stay updated. When setting up telehealth appointments, providers should confirm the patient's physical location during the visit. They also need to verify the licensing requirements and understand the billing policies of the patient's insurance plan to avoid claim denials. This is particularly important for mental health therapy, where state laws can be complicated. In summary, cross-state telehealth billing rules focus on state licensing compliance, varying billing policies, and adherence to Medicare, Medicaid, and private payer guidelines. Providers must navigate these regulations carefully to ensure they can practice legally and receive payment for their services.